Welcome back, everyone. Hope people had a chance to get lunch and are enjoying day two of the conference. Thank you, everybody, for the fabulous questions and great participation. And a special big thank you to our amazing speakers. You have an absolutely fantastic lineup coming up for the next panel that Adrian will be introducing. And we also want to encourage people to join us for the members meeting later this afternoon, as well as the youth panel and other events that are coming up. But right now, it is my absolute pleasure to give a huge congratulations to our 2025 Poster Award winners. It was an amazingly competitive group with, I think we had over 80 posters that people were presenting at the conference with absolutely fabulous work. And a big congratulations to Olive, Snigdha, Taylor, Tyler, and Stephen for their really fantastic presentations. Amazing work on dissemination, engagement, reaching underserved populations, and really innovative ways that they are advancing the field. So please join me in congratulating them when you see them on different events. Please make sure you pass on congrats. And with that, I am thrilled to pass it over to Adrian to introduce our fantastic panel now.
Thank you so much, Bethany. Thank you all for joining us. So today we'll be having a panel on discussing digital mental health in the shifting political and healthcare landscape. We're waiting on one more panelist who's having some technical difficulties, but we'll go ahead and get started until Adimika joins us. So it's my pleasure to start introducing our panelists today. So first we have Vaile Wright, who's the Senior Director of Healthcare Innovation at the American Psychological Association, where she leads initiatives using technology and data to expand access, measure outcomes, and improve mental health systems. She's a licensed psychologist and frequent media expert on telehealth, AI, and equity. Welcome, Vaile. Next, we have Stephen Schueller, who's a professor at UC Irvine and director of the Team Lab, where he focuses on the development and implementation of digital mental health tools. Clinical psychologist, his work aims to increase access and usability of services across diverse populations and settings. Thanks for joining us, Stephen. And then we have Chris Hemphill, who's a senior director of commercial intelligence at Wobot and a McSilver Fellow at NYU. They apply data science and qualitative insights to advance equity in AI-powered mental health and reduce algorithmic bias in healthcare systems. We also have, I'll introduce Adimika, hopefully she makes it in. Adimika Meadows Arthur is the CEO of Health Tech for Medicaid, a national nonprofit advancing innovation and equity in Medicaid, a clinical epidemiologist and former hospital executive. She leads cross-sector efforts to bring technology-driven solutions to historically underserved communities. Great. So welcome, everybody. Thanks for joining us again. Oh, sorry about that. As you can see, Chris is no longer our Wobot. Chris can tell us a little bit more about what they're doing at this point. So let's go ahead and get started. So first, we want to talk a little bit about, there's obviously been a lot of change in the landscape of healthcare research, which is impacting digital mental health as well. And wanted to hear about in what ways do you see the volatility in political and healthcare landscape affecting the field's ability to develop and deliver quality digital mental health services for large-scale benefit? Big question. I know you all have all the answers. Would like to chime in first.
I mean, I can say I think one of the challenges always with volatility is it's hard to make long-term plans as things are shifting so quickly. I think we have to be really nimble. And I think with digital mental health, there's still a lot of work we need to do, and it's not work that is going to happen overnight. And so I think it's just really challenging to make those long-term plans when things are shifting so quickly. So I've been really impressed with the flexibility and the nimbleness and the creativity of people, but I just want to acknowledge it's really, really hard to plan long term, in longer cycles when we've got volatility like we have right now.
I want to piggyback on that a little bit and say that like we have people that have been in this space for long time, 2 years, 5 years, decades, and like that. They've made long-term plans and made long-term commitments and investments in themselves that then they see undermined by some of the things that come up during this volatility. And I think it's a reminder that we feel that initial shock and we need to take a break. We need to take rest. But then there is that reminder that the science that's been uncovered, the inequities that have been uncovered and things like that, just because of what's happening at that political landscape today, doesn't erase all that has happened in the past. So it's a reminder that we should take that rest, take the time, take the hits, and not show up exhausted. But just a reminder that hey, it's volatile now, but there's change that we can make, and we've been working on.
And I would say, despite the volatility, the issues that we were trying to solve, say, before this administration are similar to what we're still trying to do, right? We still don't have a regulatory system that really operates the way that we need it to ensure that digital tools are safe and effective. We don't have, traditional reimbursement pathways just weren't developed, weren't built for these types of innovations. And so while I think improvements have been made, there's still a lot of work to do. I think there's still a lack of trust and understanding about what these digital tools are and what they aren't. So these were all problems last year, the year before that, the year before that, and they'll continue to be. I think what changes somewhat is the messaging, right? How do we deliver our messages in a volatile time when there are different people potentially in charge than before?
Great. That's a great start. And just want to remind folks to please enter in any questions you have using the Q&A, or you can also use the chat. I'll be monitoring that as well. So digging down a little bit deeper, I'm curious if you all could talk a little bit about specific ways in which kind of these these changes have affected your work specifically. And then thinking also about how do you advance your mission in a consistent way when there is so much uncertainty?
I'll kick it off. I'll just say that even though I'm a fellow of the NYU McSilver Institute and all that, but I'm not receiving any federal funds for my work, and I have more of a liberty to be able to speak out on these issues in the way that I want and use unallowed words like health equity and stuff like that. So seeing how this has impacted my colleagues, and even at NYU, seeing how a group of people who strongly believe in health equity, in the focus on the mission, are having to change the language on the website and the outgoing communications and everything like that. That's led to trying to help out in little ways that I can. Like I have the privilege of being able to have a bit of a voice. So one thing was to start out this podcast called Hope, Power, and Healthcare, which is just designed to remind people of the agency that you still have in creating the future of healthcare.
Great. Thank you for that, Chris. I just want to pause and welcome Adimika thank you for joining us. I'm glad you figure out some of those tech issues.
It wouldn't be technology without there being a challenge.
Yes, absolutely. So we're just talking a little bit about how some of the volatility has impacted your own work. And I think Vaile was going to say something.
Sure. I think we're certainly seeing a trend across the country around deregulation. In particular, the federal government leading a lot of those charges with their Medicare deregulation RFI that is due today. And so when the feds choose to move away from regulation, particularly in the digital health space, then it falls onto the states. And so it's created a unique challenge for us at APA because we don't have state lobbyists in order to really track all the legislation that's happening, particularly as it relates to AI and digital tools. And so I think that's certainly shifted the work that we've been doing quite a bit. within APA is how do we work, again, as collaboratively as possible with our state psychological associations so that they know to be on the lookout for state legislation for digital tools in mental health. And because while there's, I think, a lot of really incredible opportunities, there are also challenges that we need to ensure that we don't have unintended consequences by the desire to innovate.
Yeah, I can talk from my perspective because I am a federally funded academic researcher, and I'll say it's a big challenge right now. And I think like thinking about like where those grants are going and where the research is going. I think on the flip side, I think that it's also an opportunity that I think us academic researchers need to do some important soul searching and also realize that messaging is really important, and not just messaging, but also the work that we're doing. So I think really on the messaging point of view, I think we really need to be better about communicating the value of what we're doing to um, diverse and different communities and people. It's not about the number of grants we're losing. It's about the impact that those grants have on people's lives and people's mental health who could be really benefited. I think another aspect is just teaming with local partners, and that might be county, that might be state, but there's a lot of resources and money in delivering services and getting things done. And so I've done a lot of evaluation work and other type of work, but you have to think about how your skills as an academic translate to questions and problems that are going on in those settings. And so I do think some of it is trying to figure out how do we take some of what we've done and our expertise and our skills and translate it into different ways that are maybe a little bit not what we've traditionally done as academics. So I think making that connection to the real world impact is really, really critical right now, because that's I think how we demonstrate the real value of the work we do.
I mean, I can jump in.
Please.
Running an organization called Health Tech for Medicaid in and of itself means that the last 5 months have been incredibly challenging. So I'll just start there. Because we center all of our work on people on Medicaid and their caregivers, I'm going to start with the centric people on Medicaid, the people that are trying to get services using digital devices, using tech enablement, and then move outside. Because I think oftentimes in the ecosystem, we often think us first versus individuals who are actually trying to get the services. And so I want to think a little bit like people centric first, and then go out from there. So I think one, there's a lot of fear. There's a lot of fear because there's a lot of mistrust, and there's a whole bunch of confusion. And every day is almost like a whiplash cycle. Just in the last few days, the events that are going on in Los Angeles, trying to make sense of what's actually happening with Medicaid. Is it going away? Is it not? Is the big beautiful bill, like all these adjectives, does that mean it's staying? Like, what does this all mean? So I will just say from the perspective of where I sit, there were some volatility always, right, in this sort of a topical area around how to develop and deliver quality digital mental health services prior. And that is really and those areas where there was kind of uncertainty around kind of telehealth flexibilities kind of post-COVID. We kind of went in either way, no matter what way the administration went, with our fingers crossed around. I think currently the regulatory whiplash that we have, whether it be around swapping out equity, around entire offices or in the federal government going away, like the office that actually counts people on Medicaid is no longer even available any longer. But I think now, volatility in federal and state healthcare policy really looks at like it's more than just telehealth reimbursement. It's more than just data privacy. It's really around Medicaid itself, right? And so this has a massive chilling effect on innovation and delivery, whether it be care delivery, whether it be service delivery, whether it be benefits delivery, right? And so I think we know more than 40 states temporarily have expanded telehealth services during the pandemic. We know what has happened recently with Medicare, that oftentimes that that Medicaid often follows that. Many of the expansions that we thought might become permanent have become this crazy patchwork of access, some of which have upended. And so that is an unwinding effect. But I also think the biggest thing is really a growing politicization of mental health specifically, and around the communities that we were spending so much time during the pandemic wanting to serve, right? So we spent a tremendous amount of time wanting to serve LGBTQ populations, wanting to serve people who were asylees and refugees, wanting to serve people in rural populations, wanting to serve individuals who had immigrant status, right? So we spent time trying to enable trust in the very communities that we're now ripping the rug underneath. And so that in of itself creates a really big challenge, where we've asked people to use modalities that people were very unfamiliar with using. They kind of had to use it because of the conditions that we were in, which was a pandemic, right? And now there's a massive mistrust, because does this mean I'm going to be kicked out of the country? Does this mean that I'm going to lose my benefits or my job, right? Because my boss is going to understand, my gender preferences. There's a lot of fear that goes well beyond what I consider to be health equity. I mean, I'm an epidemiologist by training. I've done health equity work my entire career. And to me, health equity is health disparities. And we cannot do healthcare without health disparities, without looking at health disparities. And so I kind of remind everyone that looking at differences between groups is actually how we can actually make the system better for everyone. Equality isn't going to get us there. It actually, in some cases, creates more of a disparity and creates more of a condition where all of us can become unsafe. So I think in looking at the individuals that are actually on programs, whether it be Medicaid, Medicare, Medicaid being the largest insured population, serving 1 in 5 Americans, you think about those individuals and then you think about their caregivers, right? Like, it's a huge swath of Americans who are, quite frankly, living under massive amounts of fear. And then you layer on top of that, many community-based organizations and nonprofits like myself, like all of our academic partners this year pulled away funding that we had with them. So that actually pulls a layer of mistrust, right? Like, all of our academic partners that we've worked years and years with, they've gotten their grants because of our community-based work. They've got, that trust is being dismantled as well, right? Like 40% of our budget went completely away because our academic partners said, like, hey, we're losing funds over here and we need this money to backfill there. And that is an erosion. So I'm worried about what this actually means for the actual ecosystem, right? And I was just at the ARM meeting, the Academy Health meeting over the weekend, and I think, like, what does this mean for international health work? What does this mean? And so it's like a ripple effect. What does it mean for the globe? What does it mean for the US? What does it mean for specific entities inside of, whether it be mental health, behavioral health, like all of these different subsets of health itself?
Thank you so much, Adimika. I think that's a good, I think what I'm hearing a couple of different things. I think there are these real challenges through changes in federal policy that are primarily impacting funding, right? Interestingly, I think what some of the things that Vaile brings up is, on the flip side, there's this deregulation, which is probably more impacting the private sector, right? So the two things are going on. There's kind of more regulation on the federal side in terms of what people can do, what people can say, who you can study. And then on the other side, there's a little bit more of an opening up around guardrails around AI or technologies and things like that, right? So it's a flip in some ways, right, from what the case was before, where there was kind of an increase in regulation in the private industry, and then a broadening.
And I would say potentially, right, because we haven't seen that yet. We don't know what the FDA looks like. We don't know. And I think, Vaile, if you're seeing things that many of us are not seeing, like, I think many of us are still waiting with bated breath as to what these deregulations are going to look like, right? Because I spent a lot of time working with CMS, a lot of times working with many of these agencies, and as much as I've been summoned back and forth, every time I turn around, the folks on the other side are no longer there. And so it's still a little bit of a quagmire as to what these systems are going to look like so that they can be regulated or not regulated. I mean, and I agree that the deregulation is going to be there. There's going to be a lot more flexibility for the private sector. I think we've seen way more like venture involvement, right? And tech bros, intermesh into, and that just by way of Doge and Elon Musk being inside the four walls of the White House, like tells you it's a different makeup of people that are in the regulatory mix that we've actually never seen before. It's like a completely different makeup of people. And we've had a mass exodus of federal workers, which is also something we've literally never seen before. We have entire offices that we relied on that are no longer there. So we're also like learning what do these building blocks look like. It's a little bit of a Jenga, and we're hoping that the whole thing doesn't, I mean, in my mind, I'm hoping the whole thing doesn't fall apart. But we're also wondering, like, when you pull one thing, is that deregulation going to actually do good, or is it going to create other problems, upstream or downstream? I don't know.
Yeah. Curious if other folks have kind of ideas around this kind of push-pull.
Well, I mean, I do think with the uncertainty in federal aspects, thinking about like what states are able to do is, I think, been something that's been more interesting to me. Of course, I have the privilege and the luck to be in a state that, California, where they have been, I think, very interested in digital mental health and have been taking some, interesting approaches in that. But I think that there's other ways in which we could be, better advocates and better educators and better working with state officials and state individuals and other states as well, if that's where you're located. So the work is still really important. The need is still there. The challenges are still, they're not solved yet. And so I think showing that flexibility, I think it goes back to some of the things like Chris and Vaile were saying earlier. I really like Chris's points about, taking some time and, making sure you put on your own, emergency mask first and make sure you're ready for it. But we still have work to do and figuring out how that's going to get done in a new system. It's not like our system was working great before. So it's not like we went from a perfectly working system to a broken system now where, broken system in one way to a broken system in another way. So I think just might take us some time to sort of figure out how to navigate some of the new challenges we're being faced with.
Yeah, and I do believe that there's space for innovation, like in times of I do believe healthcare is super hyper local. Like I ran hospitals for 15 years before starting health tech for Medicaid. If I know anything, I know that healthcare is super hyper local. So I think like Steven's saying, Medicaid's done 56 different ways when you look at the territories, the districts, and the states, right? That's a lot of different flexibility. I think where we may have some challenges is when and if, depending on what happens with all this, the sea changes or headwinds or tailwinds, right? If folks are going to have to adjust state budgets, right? What are they going to cut? People, benefits, where is that money going to go? But I do think that on a municipality perspective, on a county level, and we have some counties that are larger than states, right? Let's be real. We have so I do think and then we have some really small creative counties, right? And we can learn a lot from different. The one thing that we have several microclimates. I mean, lots of different the diversity, geographic, economic, socioeconomic, I mean, across the US is so vast that I think there is an opportunity for us to have so much more. And I think that this is a time where, and I do think in times where there are massive constraints, it's easier for us to come together and not fight over who got 51 cents and who got 49 cents. But it's we realize there's only $1, so we've got to all work together. And so I think instead of infighting, there will be a lot more collaboration. I'm hoping for.
Yeah, actually, that's what I was going to pick up. Oh, I'm sorry, Chris. Do you want to go?
No, that's you.
Actually, that's what I was going to pick up on too. I mean, in the federal administration right now, it's constant contradiction, right? They want to focus on nutrition, but they don't want us to measure social determinants of health anymore to determine food insecurity, right? They want to focus on digital mental health, but they don't want any sort of regulations or any sort of guardrails. They just want American innovation and leadership. So I think what that's done is at least associations like APA and AdvaMed and ATA are all working very collaboratively to have aligned messaging, to really come across and say, look, where are the opportunities for innovation, for addressing digital tools and getting them more scalable and paid for, and how can we all come together with one voice? It doesn't have to be just one solution. I think there needs to be multiple solutions, but I think coming together in a collaborative way, unlike I've ever seen before, even just in this particular cycle, the way we're all sharing our RFI responses with each other, so that we're all again on the same page, has been really eye-opening to me. And so I do think that that is one silver lining. And, I guess we will see when the proposed rule comes out exactly what it's going to look like going forward.
And related to RFIs, I just wanted to throw out one quick reminder. It was mentioned on a session earlier today about CMS's RFI call for innovation. I believe that's due on the 16th, so get on that right now. And the big thing about it, I read the RFI, I read some of the responses, but the RFI itself is sanitized of all language, like it doesn't mention social determinants of health. Control F, health equity, you won't find anything there. So I think it's an opportunity for people who are working in this space and have a lot of meaning and background in this space to put that reminder out there in your RFI response. And the reason I'm so motivated to say that is because Aubrey Schick, who recently left the FDA, so still has fresh insider insight, she said on that earlier panel that if there are things or if there are programs that people might have that are advocating for internally, but they can't get the pressure on up on the administration to move on their own, well, that outsider input, seeing that a high volume of that good outsider input helps those efforts internally. So just wanted to put out a strong encouragement to get those responses to that RFI. I'm working on mine.
That's great. Thanks so much. Related to that, I'm going to get to a couple of these questions in the Q&A. Are there ways to get disruptive in terms of funding and create non-federal funding sources to kickstart projects? For example, is there more opportunity for industry academia collaboration?
I can speak from one angle of industry perspective. So look, my background is entirely industry. So my insight is going to be specifically on the way it's looked at things in terms of healthcare innovators trying to appeal to the healthcare infrastructure. But one thing to focus on is the research around the returns on investment around health equity and social determinants of health. If you look to Dr. Jay Bott, who is one of the health equity leaders at Deloitte, came out with some research that quantified the cost of health inequity is costing our healthcare system $340 billion per year. I think this research came out back in 2022. But it doesn't directly answer the question on creating new funding sources, but for people that are working internally and they have health equity initiatives and things like that they want to move forward, it's understanding what that link is between the savings or opportunity growth for the clients on the other end. And I can give a personal story on that, which is back in my days at this company called Actium Health. I was on a data science team where we were designing algorithms to help with healthcare outreach to address people with cardiology needs and other needs. Well, we were very proud of our algorithms. They had a very high success rate of 0.85 AUC. It was just kind of a percentage. But then when we started breaking it down by the intersection of race and then the intersection of race and gender, we started seeing that for subgroups within those populations, things started to fail. The accuracy started to go down. So is it like when you're working, like when you're working on that kind of initiative, how you bubble it to, how did we bubble it up to the top? Well, we knew that healthcare systems were interested in having equitable outreach, and at the same time, we identified how much loss there was lost opportunity by not reaching out to these people in need in these underserved groups. So we found a way to do the mission work, oriented work that we wanted to do, but tie it to a commercial gain so that the project was sustainable.
Great. Thanks so much.
Yeah, I think we should take dollars wherever we can find them. Not saying we should take dollars from anyone, but I think industry academic partnerships can be great. I've done some work here in Orange County with our county Medicaid program to think about opportunities for funding through them. I've gotten funding through states from foundation sources. I think diversifying funding is great. I think thinking about then what that means we need to do with, as an academic, like what does the research look like when you have an academic industry partnership? And I do think it can't, it's not, these fundings opportunities are usually not like, okay, here's the work I want to do, and now please give me money to do it. It looks different. And so I think it's a mindset shift that has to happen as you're kind of going to these different funding sources, and they're all looking for things a little bit different. If you're looking for industry funding or foundation funding or sort of, Medicaid funding, how you might link into that. So I think it does require a lot of education on your side as an academic to think about like, okay, what can you bring into those different settings? But yeah, if there's a dollar there, I would try to take it.
I do think that the ecosystem of funding looks different. I think partnerships are going to be really important, but I think trust in those partnerships are going to be equally deeply important. I think that there's been a little burning of folks, a lot of folks were definitely not expecting some of the drastic changes academic institutions were not used to or willing to see their, folks are really, academic institutions kind of work on this, like they need to have their overhead paid for. There's, we're not used to seeing this level of federal workers out on the streets. I mean, it's a completely different ballgame now. The way that people are looking for jobs, the talent pool, like everything's different. Philanthropy is being like totally taxed. It's almost like, don't call. I mean, they are just getting kicked in the pants. I was at a meeting on Saturday that two philanthropic folks pulled together, and they literally started the meeting with, if you're coming to us with don't send a concept note. Like, we have exhausted, like, we don't fund this sort of stuff. We've been tapped out, because they're also getting funding for like advocacy and all of these other like different areas too. So I think while we have to get creative, I think we also have to be realistic that this is not a windfall time, that we're gonna have to get a lot more creative. And that means like this is not we may have to trim a little bit of fat, I guess is the best way for me to put it.
The old do less with more. Do more with less.
Or both, whatever.
Yeah.
whatever fits your fancy. But but I think, yes, I think we're gonna have to strike while the iron is hot, if you're able to do that. And and then also but I think the big thing is like trust. When you have partners, be good partners. When you have collaborators, be a good collaborator. Because there's somebody else behind you, right? Your mess up of that industry partnership really screws up the person behind you. Folks that are in academic institutions, like it's the difference between your postdocs and others, like getting an opportunity to have research funded. And, I mean, it's not just about us, it's also about I think about like, if we can do our work, it's the quality and duration of people's lives being saved, right? And so going back to the why and our mission versus like just the dollar is really going to be kind of critical.
Yeah.
Can I actually make a quick, and this is maybe more specific to the academic audiences, but maybe riffing off your sort of do less with more gaff there, Adrian. Maybe we should be doing less. Like, I do think that there's been a lot of stages in academia where, we're publishing a lot of papers, we're getting a lot out there, and we're not always thinking about the value. And so, maybe this is really the time where we dig deep and we do that harder, slower work that's more important in terms of the impact. And so I would just really encourage, if you're in academia and you hold power of any kinds, like, read the papers for the faculty you're hiring. Don't just count the number of lines on the CV. Like, this is the time I think we really need to be thinking about like what we value, and if we value that, like let's support it. And so maybe there is a slower quality of the work, and we have to think about the value. And I think going back to the point I made earlier about we need to make sure that we're demonstrating our value as academics to different, groups and different people. Like, it's not about getting another paper out there. It's like, what did we change? Who did we help? How can this impact people? And so, those of us with power, I think, need to try to make changes to, really emphasize the value of work rather than just the bean counting of the numbers. So,
And I'll
I think
also
that's
just
something we have to think about.
I'll also just challenge the academic environment. This is also a time to make sure that you're diversifying your staff, right? There's a lot more folks out there in the talent pool, and I think an opportunity for you to, while there's this kind of attack on DEI, it doesn't mean don't hire women, right? It doesn't mean don't hire people of color. It doesn't mean don't hire, like it actually means use this opportunity to hire, right? And get those lenses in your academic institution while you can.
Great. So next, this will hopefully address a couple of the questions in there, but thinking a little bit about advice that you have for folks that are maybe earlier in their career, navigating professional development, applying for schools, jobs, funding, things like that. There are a couple of questions specifically around funding and PhD programs, and also people doing, work that's, culturally relevant to a broad swath of people, right? What are some of the things that you would tell people that are going into this really uncertain environment? I think we're dealing with uncertainty, but many of us have some level of security, right, or other options. And I think people earlier in their career are maybe feeling questioning what the next few steps are, what things are going to look like. So much has changed in the preparation to get into this field.
I'll just kick it off with like, as hard as things are now, it was never easy, right? Like we're talking about like for social determinants of health specifically, we're talking about 20 to 30 years of prior research and work that was challenged and rejected. I think about Dr. Amaka Nyanye, who is the currently Chief Transformation Officer at Emory Emory Health System, or Emory University, I believe. But prior to that, she had actually led research on identifying the racial bias in CKD algorithms that were being used. And this was back in the late 2010s. And she gave a talk on it, and I asked her, and we're talking about late 2010s at the height of, like we're talking Me Too movement, everything like that. We were in vogue. But she said that when she revealed that research assailing the prior scientific study, she said that was absolutely the most difficult time in her career, the onslaught that she had to deal with and fight back against. So it was never easy. There's been a lot of people, and if you're young, you're kind of coming into it and seeing, oh, this is horrible. But I just wanted to just remind that, hey, a lot of us has been in here a long time trying to make that voice heard, and the movement's still being made.
Thanks for that I think dose of hope that we need.
And I think there's never, I'm one, she's a really good colleague and friend. And so I would say, one, she has totally transformed kidney care, but how it got done, let me just be real, is those of us on the back channel who literally made sure on every stage and panel we put her research on. So the one of us that was at Google, and the other one of us that was on this stage, and those of us who was at APHA. So, I mean, let's not forget the Underground Railroad of the ability for us to support each other's work. And that's the other piece of what we're going to have to do in order to get through the next, 1,312 days or so.
I mean, I think to piggyback on that, the only constant is change. That doesn't mean that it's going to necessarily get better. But I will say, things just don't stay the same. They don't forever. And so trying to have the long view, I think, is critical. Some of those on the call, myself included, was entering the job market postdoc in 2008, 2009, which was during the recession. And so, there have been, to Chris's point, challenging times in the past as well, yet we still come through it. I think it's how you approach it that can be very helpful, because there is so much that is outside of our control, but what is in your control? And I think for me, what I always hark back to is thinking about what are the unique skills, perspectives, ideas that you bring to whatever situation you're going to come into, and how can you capitalize on those even if the situation itself isn't perfect. What can you do? What is unique about you? What is the reason that you are there that nobody else can fill? And then pursue that. And it may need to, reset expectations, I think, as someone said earlier, and think about small wins as still big wins. But that, I think, is part of the attitude that we need to have moving forward, as well as the sense of how can we lift each other up, as Adimika said.
Great. Thank you all for that. Let me get to some of these questions in the Q&A. So one, maybe Stephen, I can pick on you for this one. So thinking about changes in academia, moving away from researching DEI and other shadow ban research terms, is the trade-off that researchers who choose a continuous line of work will not be able to advise graduate students in the coming years? Will the ripple effects lead to fully funded programs to shrink in size, eventually be replaced by unfunded ones, even at public universities? Should students hoping to be admitted to PhD programs in coming years search for individual funding before applying?
Yeah, I mean, there's a lot of questions there. I'll try to see how many of them I can address. I mean, I think if you have individual funding before you apply, that would be great. As I said, take whatever dollar you can get. I don't know how feasible or how likely that's going to be. I mean, I think maybe I'd like to echo some of the points Chris made, is that this work has never been easy, and that in some ways it started to get popular, and that was great. But there were people doing, DEI and working with different populations before that work was popular. And I think that's going to continue even with the challenges that's being faced with the current administration and the lack of enthusiasm at best and direct attacks at worst, which is going on. And so I think that it makes the work really even more important at this time, in terms of being able to think about how we do that work. So I think if that's your passion, I think you can still get that work done. And I think that it might, you have to think about how to do it more leanly. And, I think, I really think that some of the points that Adimika was making about, partnerships and trust, that's really important, and making sure you're building those partnerships and trust to bring in different groups. But I think that there's still enormous need and enormous potential to be able to do that type of work. I think it's just, we need to think about, how we're getting it done, what resources we're using to get it done. So I can definitely understand it being an anxious time to come in as a PhD student. And I definitely think that for those who are kind of early in their career, those are the ones I'm like the most worried about too. But I think that there are resources and there's people who support you. And I think if that's the work you're passionate about, there are still opportunities to do it.
Great. Thank you, Stephen. there are a couple of questions about the kind of regulation issues, deregulation that we talked about, that Vaile in particular brought up. Maybe I'll combine them. Do you think there's still potential for federal government to address overreach by companies? For example, if they say they're an AI therapist, one example Another way that this impacts the work is communicating to patients that their care isn't compromised despite potential deregulation. Things that haven't been tested as much, for example.
So I'll start with the first part. To be really clear, there wasn't a whole lot of movement on the federal side to regulate AI before this new administration. I think the language was really different. Under Biden's executive order, it was about being safe and responsible. Under Trump's, it's about American leadership. But there wasn't a lot of concrete movement. We at APA, we did meet with two democratically appointed commissioners to the FTC to express our concerns around the AI therapist issue. Those two individuals were subsequently fired, not as a result of our meeting, I don't think, but it does give this sort of sense of, at the federal level, what their appetite is around regulation. And for them, they see it actually as a First Amendment issue. So I don't see that happening. So instead, what you have happening is it's getting legislated via civil action lawsuits, as well as, again, at the state level. So you're seeing a patchwork approach to regulating, particularly these AI chatbots and therapists at the state level. And in the absence of federal legislation, it's probably better than nothing. But I think it puts a lot of onus on providers, as does the second part of your question, right? As you continue to deregulate, how do you as a provider know what is safe and effective to offer to your patients, and can feel that confidence that what you've selected or what you're offering or recommending really is going to do what it says it's going to do. And without that confidence, I think providers are going to continually turn away from implementing these types of digital tools into spaces because the fears of liability and other issues. So I think that there is some sweet spot in here. I don't think we found it yet, but that is what I'm hopeful, and certainly what we try to do at APA.
Great. All right, so we have time for one more question. So I'm going to ask you all to do kind of a 1-minute response on looking forward. Thinking about what are some of your best guesses about how the digital mental health field will look different in the next couple of years. Chris, I'll start with you.
Dang, predictions, they're so hard. 1 year's not too far off though. Yeah, so
you can say a little bit beyond that. There's going to be a lot of shift too.
Yeah. Like I said, like I was talking about earlier, it's been a difficult journey, and outside of the health equity part, like getting digital mental health to be a recognized field, and as Vaile was alluding to, like getting science respected around it. I'm very encouraged by third-party, financially disinterested organizations like the Peterson Health Technology Institute. That was brought up in an earlier session too. I love when they put out and put the effort into doing research on these firms, because that becomes a third-party validation, much better than looking at the white paper on someone's website. So I'm thinking that like if they continue initiatives like that, and we continue gatherings around this digital front, that their moves will be made not just 1 year, but also even further out.
Great. Thanks, Chris. Stephen.
Yeah, we were joking a little bit backstage, and I was saying, I always say it's very easy to predict the future. It's hard to be right. So I'll disagree with Chris on one thing. It's easy to make predictions. Predictions are easy. I'll maybe say two things. I think one is I think AI is going to transform everything, and I don't know how yet, but so that's an easy prediction. AI is going to be big. I think one place where I'm really bullish on AI in the near term is AI in sort of provider-facing directions. So thinking about how we can use AI to help, people of various professional certifications and licensures effectively work at the top of their license and work at the top of their training. So I've seen instances of AI in sort of peer support platforms or in sort of lay professionals, paraprofessionals. And I think that that's really cool to be able to really see that combination of technology and human to allow humans to be the best at being humans as technology advances. And then there was something that was brought up on another panel that really, I think resonated with me, but I think there's a lot of work that, I sometimes say boring work. I think the way the other panelists put it was like the not as shiny work, but I think as academics, we're often like over focused on like innovation and doing like the newest and the cutting edge stuff. And I think there's just a lot of like really deep, like we have to get our hands dirty work we need to do around advocacy and implementation and contracting and partnerships and all this kind of like reimbursement, all this like messy stuff that if we don't figure out, we can have the coolest, shiniest looking digital mental health platform, and it's not going to make a lick of difference in the world. So, the two places I would sort of say we think we need to be thinking in the near term is, thinking about AI and these ways to really help people be the best people. And then also, how do we get like our hands dirty and dig deep in this, the messy stuff we need to do to actually get the stuff to work.
Thanks. Vaile, last word.
I'll go quick because I know we're at time. In our most recent APA Stress in America survey, 71% of 18 to 34-year-olds said that they won't talk to about their stress with others because they don't want to burden anybody. And I think that's why you're really seeing this movement towards using these AI chatbots that weren't built for mental health purposes being used for mental health purposes. I think that is going to continue until we can have some sort of cultural shift where we help people understand the value of real connection, of using products that were built for these purposes, and why they're better than these other products. And I think we need to be having these conversations much more broadly and much more emphatically in order to shift people towards a place where they're suffering less faster.
Great. Thanks, Vaile. Now Chris is going to close us out.
Okay, I just want to say that when I think about an audience of motivated and educated people that are trying to make a difference in digital mental health, I think about like what the difference would be if Steven Schueller hadn't advocated for growing a responsible approach to AI. And I think that prediction, when you predict the future, you cause the future. So the stuff that we say and hear and think, we're willing that into existence through our efforts. And I think that's a good thing to go away from. That comes from a really good book on AI ethics called Weapons of Math Destruction.
Thank you, Chris. Thank you, Steven. Thank you, Vaile, so much. To Adimika, who had to leave to another presentation. And thank you to all for joining us. I'm feeling more hopeful, and hopefully you are too. Bye, everyone.
Appreciate it.
Thanks.